My name is Aisling Foley, and I've been invited by community keepers to speak to you about fetal alcohol spectrum disorder. So what is fetal alcohol spectrum disorder, or FAS for short? It's permanent brain damage for which there is no cure. And it's caused by exposing a developing fetus to alcohol during pregnancy. So it's two things: pregnancy and alcohol. And the two of those together can lead to possible brain damage to a developing baby. Whatever mom drinks during pregnancy, her baby does too. Alcohol goes straight into a baby's bloodstream, and if mom gets drunk, so does her baby. Always remember that a pregnant woman never drinks alone. So if FAS is permanent brain damage, let's take a look at the FAS brain. The brain is the organ that's most affected by prenatal alcohol exposure. And our brains are more impressionable in early life, and that has advantages and disadvantages. The disadvantage is once the alcohol does the damage to the developing brain, it's permanent and it cannot be fixed. But the advantage of having a brain that is impressionable in early life is if we can get a child early in life, we cannot fix that brain, but what we can do is we can teach that child to use that brain as best they can. Alcohol can also damage other parts of the body. So we will often see that somebody with FAS will have other physical health issues as well, such as heart defects, asthma, ADHD, cerebral palsy, epilepsy, or dyslexia. So why must we worry about FAS in South Africa? Well, South Africa has the highest rate of FAS in the entire world, number one. There are approximately 60 to 72,000 children born every single year in South Africa suffering from FAS. And that makes FAS South Africa's largest birth defect. There are approximately 6 million FAS sufferers in South Africa. How does alcohol affect a child's development? As a rule of thumb, children with FAS function at about half their physical age. So, for example, an 8-year-old will act more like a 4-year-old. A 4-year-old might be still having the 2-year-old temper tantrums. The primary disability of FAS is brain damage. Everyone with FAS has brain damage to different degrees, from low to high. The common primary disabilities linked with FAS include: number one, cognitive disabilities, so problems with thinking or learning. Number two, behavioral disabilities, problems with actions. Number three, physical disabilities, problems with body and health. So let's take a look at each of these in more detail. Number one, cognitive disabilities. So typically, you will see a child that may have difficulty with organizing and following through, difficulty with memory, poor judgment, trouble making choices or making decisions, telling untruths, communication problems. Number two, behavioral disabilities. So perhaps problems getting along with others, impulsive, lack of boundaries and personal space, struggling with regulating their emotions, blaming others and defiance, inability to explain emotions and feelings, being easily influenced, immaturity, vulnerable to peer pressure and influence, being hyperactive, easily overwhelmed, and changes in activities or plans can be hard for them. Number 3, physical disabilities. Problems with fine and gross motor skills, poor hand-eye coordination, lower height or weight, hearing or eyesight impairments, and poor functioning or poorly developed body systems. There was a study done in 1996 which followed a group of almost 500 people with FAS to see how their lives turned out. Unfortunately, these people encountered a lot of challenges and difficulties in various areas of their lives. Let's look at these challenges to better understand what it actually means to have FAS. So everyone in that group suffered from primary brain damage to a lesser or higher degree. In addition, most people in the group also suffered from secondary disabilities. Secondary disabilities are not present at birth, but they can occur as a result of the primary brain disability. The good news is that secondary disabilities can presumably be prevented or lessened by better understanding and appropriate interventions, such as education. So the main secondary disabilities that the members of the group suffered from were as follows. Number 1, mental health problems. So things like depression, suicide, anxiety, eating disorders, schizophrenia, self-harming. So 94% of the group suffered from mental health problems. During childhood, we see that ADHD is extremely common. Number 2, a disrupted school experience. So being suspended, expelled, or dropping out of school. Almost half of the group had a disrupted school experience. Number 3, trouble with the law. Involvement with the police, being charged or convicted of a crime. Almost half of those in the group got in trouble with the law. Number 4, confinement. Inpatient treatment for mental health, alcohol or drug problems, or incarceration for crime. More than half of the group had been confined at some point during their lives. Number 5, inappropriate sexual behavior. Things like sexual advances, sexual touching, promiscuity, rape, or incest. Almost half the group aged 12 and over engaged in this inappropriate sexual behavior. And this often results in unwanted pregnancies, STDs, AIDS, and prostitution. Number 6, alcohol and drug problems. Members of the group suffered from this problem 5 times more than the general population. Number 7, dependent living. 80% of the group members could not live independently. Number 8, problems with employment. 80% of the group had problems with employment. So either they could not get a job or they could not keep a job. Number 9, problems with parenting. When those in the group had children themselves, almost half of them drank alcohol during pregnancy. And in turn, their children ended up in the care system. In general, the majority of children with FAS do not live with their biological parents. They often live with other family members or they are in state care. They often come from unstable families where physical abuse, sexual abuse, and neglect are very common. So how might you as an educator identify a child with FAS in the classroom setting? Well, firstly, be aware that a child with FAS looks neurotypical. So FAS is usually apparent from their behavior. A child with FAS might appear as hyperactive, have bad concentration, have learning difficulties. They might fall asleep in class. They might be very talkative or angry and physically aggressive. You might find they daydream for more than half of class time. They could be forgetful. They could complain of headaches or other physical illnesses. They could be confused with time or homework. They could be emotional with tears, anxiety, or staring. They could have increased sexual activity. They could be abusing alcohol or drugs. There could be a history of physical or sexual abuse and/or neglect. They might be living in foster care with a history of different placements. Most importantly, there could be a history of family alcohol abuse. This is important because, of course, in order to be diagnosed with FAS, there has to have been alcohol during pregnancy. Beware, though, that children without FAS could also display many of the above characteristics. So even though you might suspect it, never try to self-diagnose FAS. FAS will always require a medical diagnosis by a doctor. So what is the educator's role in FAS? Well, you could raise awareness about FAS, spread the word about the dangers of consuming alcohol during pregnancy. You could perhaps run a campaign on International FAS Day, which is the 9th of September every year, which is the 9th day of the 9th month, representing the 9 months of pregnancy. You could consider running education programs for older students in your school about FAS. You could use some of the classroom solutions set out in this presentation. You could understand that given the number of children with FAS, it is highly likely that they will be in your class. And also, very few children with FAS are actually diagnosed. That said, don't let the absence of a diagnosis stop you from using some of these suggested solutions if they could help a child. Some suggested solutions for educators and parents: speak simply in short sentences when speaking to the child. Maintain eye contact on his or her level when speaking to them. Encourage the child to keep their desk or their room tidy, and only take out materials or toys when they're needed, and pack them away afterwards. Only give one instruction at a time to the child. Understand that the child may know something today and forget it tomorrow. Allow the child more time to complete a task. Give them frequent reminders about the rules. Tell them what to do rather than what not to do. For example, walk rather than don't run. Have a routine and notify them of changes in the routine in advance. Sensory overload can often lead to meltdowns, so allow calming down in a quiet corner. Be patient. It's often that the child can't do it rather than they won't do it. Show them as well as tell them what to do. Use positive messages of encouragement. Repeat, repeat, repeat. And encourage their strengths. Children with FAS tend to excel in things like dance, music, art, working with animals, cooking, and hands-on trades like mechanic or gardening, carpentry, a chef or a plumber. So to summarize, Remember that FAS is permanent brain damage for which there is no cure. So spread the word. Don't drink any alcohol during pregnancy. Thank you.